Hi, everyone. Welcome to today's session, using CTC data in your outreach plan. I am seeing that people are just joining now, so I'll just give it another 10, 15 seconds and then we'll kick it off. All right, we have a number of folks who have joined, so I think we have reached critical mass for today. So again, welcome. Good afternoon. If you're in the afternoon, we are here on the East Coast. I'm Jenny Huang, Outreach Manager at the Center on Budget and Policy Priorities, and I'm very excited for the session we have for you all today. Celine, if you can turn it over to the next slide. So before we get started, wanted to do a quick introduction. So I'm Jenny Huang, as I said, and I work at the Center on Budget and Policy Priorities. We are a nonpartisan research and policy institute, and we pursue federal and state policies designed both to reduce inequity and poverty. And if you go to the next slide, thank you. So a few of us, Roxy, Christine, and myself, work on the Get It Back campaign, which is a national effort to connect eligible folks to tax benefits like the EITC, the CTC that we're talking about today, and free tax preparation. And so for today, we have just an awesome conversation. So the past year, we've really focused a lot of our attention on the CTC with, of course, the CTC expansion that has happened. And so with all of the research and data that's come out in the past year, we wanted to just make sure that we were getting that information out there. So today's session will be on the different research and data that we have on the CTC. So we will start with a quick overview of some CTC basics, and then we'll turn it over to Ashley from CLASP, who will cover some of their findings from national surveys. Claire will then talk about the pulse data and what the impact of CTC payments has been on families. Debbie Stein will be covering some of the focus groups that they did on CTC. And then we will turn it over to Richard, who will cover some great CTC heat maps and go into more of that zip code data that you all have been asking for. And then to end it today, we will have about 15 minutes at the end for questions. So please put any questions you have in that Q&A box and we will get to them. We'll keep track of them and get to them at the end. So before we get started, and as we get started rather, we would love to hear where people are joining us from. So if you could open that chat box and set it to all participants, we would love to hear who you are, where you're joining us from, and what organization you're in. And, you know, if there's anything fun you want to share, if you have any travel plans for next week, we would love to hear that. And with that, I will turn it over to Christine, who will start us off with some CTC basics today.
Awesome. Thank you, Jenny, for the warm welcome, and welcome everyone. So before we dive into the nitty-gritty data pertaining to the CTC, I just want to give everyone a brief refresher on the CTC, although I'm sure none of you need it. So under the American Rescue Plan, almost every family can receive money from the child tax credit. And this includes families that haven't filed a tax return, families without recent income, and families who have a child with a social security number, even if the parents or caregivers themselves don't have a social security number. They can have either an SSN or an individual taxpayer identification number, also known as an ITIN. Qualifying households will receive $3,600 for each child under 6 years old and $3,000 for each child between 6 and 17 years old. And families have been receiving half of the amount that they qualify for in 2021 through monthly payments, and they'll get the rest of the other half when they file their tax return in 2022. But of course, if they haven't gotten any of their advance payments, there's no worries. They can get the full amount in 2022 by filing a tax return. And currently, this expansion is only for 1 year, but of course, we're hoping that it becomes permanent. So with that, I am so excited to have the honor to introduce our 4 amazing panelists today. We'll be talking about the impactful and insightful policy, research, and data work they have done for the CTC and what organizations can do with this wealth of research in regards to outreach work. So to get started with our first panelist, Ashley, she'll be sharing with us her findings from the 2 national CTC surveys she conducted. Ashley Burnside is a policy analyst with the Income and Work Support team at CLASP. She focuses on refundable tax credits, including the child tax credit and the earned income tax credit and TANF cash assistance. In this role, she has led a national survey project on the CTC and how it is impacting families. Prior to joining CLASP, Ashley was a research assistant at the Center on Budget and Policy Priorities, where she focused on TANF. Ashley also was an Emerson National Hunger Fellow with Congressional Hunger Center. So with that, I will pass it off to Ashley.
Thanks so much, Christine, and thank you to the Center on Budget for having me as a part of this webinar today. So like Christine said, I'm going to talk about some findings from 2 national surveys that CLASP did in partnership with numerous other organizations, some of which are on this webinar, to survey families about the child tax credit. And I'll share some of the implications from those findings with you all that can influence your outreach methods over the next few months. Next slide, please. Before I dive into some of the findings, I just wanted to give a quick overview on the methodology we used for these surveys. Both surveys were done in partnership with the Ipsos polling firm and polled parents who have at least 1 child in the household under 18 years old, and both were nationally representative samples. The first survey was done in July in the first 2 weeks of the month prior to the monthly payments going out to families. We reached 1,031 respondents who made under $150,000 in 2020. In that survey, we largely asked families about their tax filing behavior, whether they had heard about the upcoming advance payments, and how they planned on spending those payments. And then in the second survey that we conducted in the 2nd and 3rd weeks of October, after families would have gotten at least 3 monthly payments, we reached 1,012 parents who were making under $75,000 per year. In that survey, we largely asked parents about whether or not they had received the monthly payments, where they had filed for the CTC, and how those monthly payments were impacting their well-being. We did post those survey findings yesterday, and I'll share the link to that report in the chat when I'm done talking. We largely found that parents reported they are spending these monthly payments towards things like bills, food and groceries, rent and mortgage, clothing and shoes, and paying off credit card and other types of debt, and that the monthly payments have helped reduce financial stress for parents, and in some instances are helping parents work more hours. These findings are especially relevant as you all think about why it's so important to do this outreach. These payments are definitely helping families. And for the remainder of the presentation, I'm going to focus on some of the findings we found of who's getting reached by the CTC payments and who are most at risk of being left out. Next slide. In the first survey we did in July, we found that 2 populations of respondents face substantial gaps in accessing the CTC. Hispanic respondents and respondents without a high school diploma or a GED. Hispanic respondents were less likely to report filing for the CTC in 2019 or 2020, and also were less likely to have received a stimulus payment last year. Respondents without a high school diploma or a GED were less likely to have claimed the CTC in the prior years as well, and also were less likely to be aware of the advance payments in the months that were coming in the months ahead. As you're thinking about outreach strategies, it's definitely important to consider how to reach out to those populations. And on this slide, we showed the responses for who had filed for the CTC in either 2019 or 2020. And 80% of all tax filers said that they had filed for those payments. And as you can see, Hispanic respondents were less likely to have reported filing in comparison to white respondents at 75 versus 84%. Next slide. For that same question, when we looked at it based on educational attainment, you can see that those without the high school diploma or GED were less likely to file for the CTC. Next slide. And then this is just showing for those who filed for the stimulus payments, who again, Hispanic population were much less likely to have received the stimulus payments in comparison to respondents of other races. This may be due to the fact that the eligibility rules for the stimulus payments changed over the course of last year, making it more complicated for mixed immigrant status families. It also may be due to the large amount of anti-immigrant rhetoric we heard from the Trump administration over the past few years, and that may have resulted in families feeling fear or uncertainty about applying. It also may be due to a lack of resources available in Spanish. These are all things that we can keep in mind as we're thinking about how to reach the Hispanic community when doing CTC outreach as well. Next slide. And then this question is when we asked if respondents were aware that monthly payments were coming, since as a reminder, we did this survey in July before the payments had started going out. And again, for those respondents without the high school diploma or GED, they were much less likely to be aware that the payments were coming in comparison to respondents with higher educational attainment. Next slide. We also asked respondents who said that they did not get the CTC why they didn't claim it. And the most common reason was that the other parent was claiming the child in their tax return. We think it's important to consider how you can frame your outreach tools and FAQs for parents in these mixed custodial situations. We've also heard anecdotally from parents that there is confusion about how the monthly payments will work in instances when the parents are sharing custody of the child and take off turns filing for the child on their tax return. So this is something to keep in mind as you're thinking about outreach methods. Next slide. We also asked in that first survey whether or not people seek help when filing their tax returns. And Hispanic respondents were more likely to say that they do seek help, with nearly half of the Hispanic respondents saying that they do seek that help when filing returns. Next slide. For those who did say they seek help, we asked what services they use, and tax preparation companies were by far the most common way. Given this, and maybe we're thinking about how we can partner with these tax preparation companies in the next few months to make sure that they are reaching out to their customers about the CTC and potential eligibility. Thinking about making sure that information is available on their websites, in their lobbies of their buildings, and things of that nature, especially given that Hispanic respondents tend to seek help when filing returns based on our survey results. Next slide. And then finally, in that July survey, we also asked respondents how they're accessing the internet, and respondents could select as many options as applied to them. As you can see, by far the most common way people can access the internet is through a cell phone. I wanted to include this in here because it shows how important it is that any resources about tax filing and the CTC are available in mobile-friendly ways, so that way as many people can access it as possible. This is why it's so exciting that the Code for America non-filer tool was mobile-friendly, because it hopefully helped more families access the website than had access prior. Next slide. This slide just shows some of those key takeaways from that first survey. And again, I think it's important to remember that there are gaps in access for the Hispanic population and for those with lower educational attainment. So as you're creating resources on the CTC, thinking about making sure those are available in different languages, that they're available in everyday language that people can understand, and that they answer the specific questions and fears that those populations may have about filing for the CTC will be really important. Next slide. And in the October survey that we just did a few weeks ago, we again found that Hispanic respondents are facing gaps in accessing the CTC. Hispanic respondents were less likely to report claiming the CTC on their tax return, just like in the July survey. And also Hispanic respondents were less likely to report receiving the advanced monthly payments over the past few months. So again, this is a population that's important to consider. And this slide shows the percent of all respondents who had filed a tax return in prior years. As you can see, a large portion of respondents had filed, which is good news as far as thinking about tax outreach. Next slide. And in that October survey, we asked whether or not respondents had claimed the CTC when filing a return. Again, for Hispanic respondents, the rates were lower at 64% versus 76% of white and Black respondents. Next slide. And in that second survey, we also asked families how they were hearing about the child tax credit. Respondents could select as many options as applied to them. And for the sake of space, not all of those response options are on this slide, but these are the most common responses that we found in the survey. The most common way that people heard about the CTC was through the IRS letter that was sent to them, notifying them of the CTC. The second most common way was through hearing about it in TV or news. And then other common ways were hearing about it through social media, from friends or family, seeing the credit on their tax form, hearing about it from tax preparation companies, and less commonly, people heard about it from the community groups in their communities. Next slide. Some of the takeaways from that is that given how many people were hearing about the CTC through letters from the IRS, it's important to think about opportunities for partnering with local and state agencies to think about doing CTC outreach, making sure those agencies are sending letters or text messages to families, notifying them that they may be eligible for the CTC and what those eligibility rules are. It's also worth noting that in this July survey, we did ask about the same question, how people were hearing about the CTC, and people were hearing about it through social media a lot less in that July survey compared to the October survey. So it seems like social media is a way that people are hearing about this more and more. So that's something to keep in mind as you're considering outreach methods. And given how many people said they heard about these payments through friends or family, it's worth thinking about hosting trainings in your community where you talk to people about what the CTC is, what the eligibility rules are, and how they can talk about it with people in their lives so that more people can tell their friends and family and neighbors about these credits and how it can benefit them. And I'll say that we've heard anecdotally that people trust information that comes from the government agencies and that comes from their friends and family. So that's important to keep in mind as you think about these methods. Next slide. I just want to close by emphasizing that filing a 2020 return is going to be essential. Like Christine was saying earlier, everybody will have to file a tax return to either get the second half of the CTC credit they're eligible for or to get the entire credit if they didn't get the monthly payments this year. In that second October survey, we asked respondents who hadn't filed for the CTC why they didn't. And the most common response is that they didn't know that they were eligible for it, even though those families were making under $75,000 a year and had at least one child in the household who would in theory have been eligible. We also asked respondents who reported not getting the monthly payments why they thought they weren't getting them, and a lot of respondents didn't know why they weren't getting them. This shows that there's still a lot of confusion and uncertainty out there about how the payments work and how to access them, which is why it's going to be really important that you all talk to folks in your community about these payments and how the eligibility rules work and try to push back against the misconceptions out there. And I also just want to emphasize again that some groups will need more support in filing a tax return, especially mixed immigrant status families, youth who are transitioning out of the foster care system, those who are experiencing homelessness, those with lower educational attainment. As you're creating resources on tax outreach, making sure that you have questions that those specific communities would be asking answered and having information that's targeted at those communities will be really helpful in making sure those folks know to file a return. And you can go to the next slide. I'll wrap up there so we have time for the other presenters, but I included my email on this slide. So do feel free to email me if you have any questions about those surveys or anything that I said. We have a lot more findings, but for the sake of time, I couldn't cover all of it. Thanks.
Awesome. Thank you, Ashley, for all your work on these surveys and sharing these insightful findings with us. This was so important in showing us who is missing on the payments and where the gaps are, and especially what are some of the reasons some families aren't claiming the CTC. So this will be great information to know how and who we should target for our outreach towards. So our next presenter, we have Claire Zippel, who will be talking about the positive impacts the CTC has had on children and families, just from the monthly payments this year. Claire Zippel is a senior research analyst in the Income and Poverty Trends team at the Center on Budget and Policy Priorities. Her recent work primarily focuses on the role of economic security programs in alleviating material hardship among families with low incomes. Claire holds a master's degree in public policy from Georgetown University and a bachelor's degree in metropolitan studies from New York University. And with that, take it away, Claire.
Hi, everyone. I'm very glad to be with you today to talk about the impact of the monthly advanced child tax credit payments. I'm hoping that the data that I will present will be helpful for you to use to marshal support, allies, and funding for your outreach efforts. Next slide, please. So a few top line numbers on the advanced child tax credit payments that have gone out so far. 61 million children in around 35 million families were reached by the fifth payment. That's the payment that went out in November most recently. A total of 77 billion in total payments have been dispersed by the IRS since July, which is a really incredible number to think about all of that money that's flowing into the pockets of families and into communities and being spent in local businesses to help families meet their basic needs. The average payment was $430 per family nationwide, and there's some variation in, across states in the average payment. And I'll talk about where you can find this data broken out by state in just a minute. Next slide, please. All right, so I wanted to talk about some early signs of success for the child tax credit. As I mentioned, 5 payments have gone out so far. It's still early days, but the data that we have so far is very promising and indicates that the child tax credit is working as intended to help families meet their basic needs and care for their families. So the most dramatic and really heartening indicator of this was the sharp decline in food insufficiency among families with children after the monthly child tax credit payments began in July. So there have been several studies. I have a slide with links to them at the end showing this decline. One study from researchers at Columbia University found that among low-income families, food insufficiency fell, the rate of food insufficiency fell by around 25%, which is just a really dramatic increase that they were able to link quite strongly to the child tax credit payments going into families' pocketbooks. We also have data on how families with low incomes are spending their payments. There are several data sources for this, including the survey that Ashley has conducted. Another source that I've looked at a lot is the Census Bureau's Household Pulse Survey, which surveys thousands of families around every 2 weeks. When we look at how families with incomes below $35,000 in 2020 are spending their payments. The most common uses can be categorized into 2 buckets. One is just the most basic household expenses. So food, rent, mortgage, utilities, clothing, car payments, and particularly for families with children under age 5, childcare. We also see families putting this money towards investments in the future. So education expenses, which given that a lot of the payments came during the back to school payment, be for kids schooling, but it also could be for the adults' education as well. Around 5% of adults in these low-income families with children are students themselves. And then also paying down different kinds of debt that can reduce future financial strain on the family. Next slide, please. So here is a chart, again, showing an average over the first 4 payments, the percent of households with incomes below $35,000 who spent their child tax credit payments on the, some or all of their child tax credit payments on these various items. Respondents could select more than one use of their payment, which is why these numbers don't sum to 100%. You can see that the most common use of the payment was food at 59% of all of all respondents and families, low-income families that received the credit, reporting that they spent some or all of it on food. Other popular uses, as you can see, were housing related, clothing, and education costs. Education costs include school books and supplies, tutoring services, after school programs, tuition, transportation to school. So if you add up those two categories, the most basic household bills plus education, 91%, the vast majority of low-income families use their child tax credit payments for those purposes, which really goes to show that families are using these payments in the ways that would most benefit their children, keeping a roof overhead, meeting the basic needs, and putting money towards education for their children and for themselves. So we found this data to be very helpful in demonstrating the real world impact that these payments are having on people's pocketbooks. Next slide, please. And I also just wanted to mention, again, and particularly the prevalence of using the child tax credit for school-related expenses. This graph is from the Census Bureau, showing that as the school year approached, the share of all parents spending their child tax credit on school-related expenses rose, which again supports the thesis that parents are using these payments to help their kids get ready for school. Next slide. All right, so as promised, I'll go over where you can find some state data on the data points that I just mentioned. So if you're looking for the total number of payments and children reached by month, as well as the cumulative amount of payment that has gone out so far by state, the Treasury Department puts out these numbers every month. This screenshot you can see is for October, but the November data just came out a few days ago. Again, there's a link to that in the slides that will circulate. So hopefully you can use this data to show how many families are benefiting already from the child tax credit in your state. Next slide, please. In terms of how families are using the payments, the Center on Budget and Policy Priorities, we put out a blog post several weeks ago that included the chart that I showed earlier on how families are spending the payments. And it also included a state-by-state table that shows in every state what share of households with low incomes are using their payments for the most basic needs and for the most basic needs and/or education costs. And just the first few states are shown here for space, but the table looks pretty similar across all the states, which is that large majorities of low-income families are using their credits in very similar ways for these very important uses. And next slide. I'm sorry, you can skip that one. So again, this is my email. Feel free to reach out, particularly if you're interested in more granular state data on how families are spending the child tax credit, and we may be able to provide that. So I'm always happy to be contacted about that. Thank you very much.
Awesome. Thank you, Claire, for sharing all the positive impacts from the CTC, especially on the effects it's had for low-income families who are using it for basic necessities or investing it in their children. And it's amazing to think about that this is just due to half of the credits being sent out. So I'm really excited to see all the data that will come out when the other half of the payment is given to families, which hopefully can mean a future webinar with lots of great news. So for our next panelist, we have Deborah Stein, who will be sharing findings her team conducted with focus groups on the CTC and how to encourage greater uptake. Deborah Stein has more than 30 years of experience in policy analysis and advocacy on behalf of vulnerable children. In April 2015, Deb became the first network director for the Partnership for America's Children, a network of over 50 state and local independent multi-issue child advocacy organizations. The partnership strengthens, connects, and inspires its members so that they can better improve the lives of children in their communities and across the country. The partnership led the Count All Kids campaign to count all young children in the 2020 census, another public outreach campaign that sought to reach many of the families that now must file to get the child tax credit. Debbie also worked at the Hatcher Group, where she led the tax credits for working families projects, and at Voices for America's Children. Debbie holds a law degree from New York University and a bachelor's degree from Princeton University. And with that, I'll hand it off to Deb.
Great, thank you so much. Next slide, please. So the goal of the focus groups that we did was to identify the barriers that got in the way of families applying for the child tax credit and the messages that would persuade them to file. It's important to realize that millions of families with young children haven't claimed the credit despite the significant value of the credit, which pretty much shows you that something's getting in the way. What I'm giving you today is an informal summary of 8 focus groups that Lake Research conducted for us with tax non-filers and with service providers who could do outreach. They will produce a formal and more detailed analysis in December, and we will get that out to everyone. Next slide, please. So the people in our non-filer focus groups are the people who have to take action to get the credit. Most people get the credit automatically because the IRS has their information. We specifically selected participants who didn't file taxes in 2020 or 2019 and didn't claim economic stimulus payments, because those are the people that have to take action to get the credit. There are a lot of people who did file for their taxes or did claim the credit or did use the IRS website to try and claim the CTC and didn't get their full credit. And these focus groups don't address those problems, but that is a separate and very significant set of problems. Next slide, please. In our 8 focus groups, we had 2 that were in person, one with families experiencing homelessness, one with white parents. We had 4 that were online with non-filers. with Black parents, with English-speaking Latinx parents, with a group of mixed immigration status families where some people have Social Security numbers and some have either ITINs or no number at all, and one with caregivers who are not the parents, where we thought there might be specific barriers. And then we did 2 with service providers who might be willing to conduct outreach to persuade people to claim the credit. One group was primarily people who work with young children in schools and childcare settings, and another was service providers who help families access financial and other support. So think people who work with the homeless or domestic violence shelters, or WIC centers, organizations where they're really focused more on bringing resources into the family. Next slide, please. The big initial findings are that you really need to talk about the child tax credit changes. So some people are not aware of the child tax credit at all, but people who are aware don't know that it nearly doubled in its value, or that they can claim more than 2 children, which means it's worth a lot more than it was in prior years. And a lot of people think they're not eligible because they weren't eligible for the old tax credit, or they don't work, or they receive Social Security, or they get disability payments, or they don't file taxes. They figure if you don't file taxes, you don't get a tax credit. So we had people in the focus groups who were eminently eligible say, oh, I can't get it because I'm on disability. Next slide, please. You have to tell them that all of those things, you can still get it with all of those. In addition, there were 2 big barriers that came up that were surprises to us, frankly, across all the groups of non-filers. The first is that people are really afraid that if they claim the credit, they'll need to pay it back. And they don't want to be put in that position. And that comes from a combination of experiences with other benefit programs. Think about SNAP, where they may have gotten SNAP benefits in good faith and the program made an error and then it got recouped. The term advance or credit seems to give them the idea that it's a loan and not a permanent payment. And some of them also have had experiences with the IRS saying that they had inappropriately claimed credits and both recouping the money and applying penalties. Underlying this fear is that parents are managing successfully to support their families on very small budgets, and they don't want to get the money and use it on things they wouldn't plan on, and then end up on even smaller budgets if the IRS recoups the money for some reason. The second big barrier is that people are afraid that if they didn't file their taxes in past years, they won't get the credit. And when we tried to tease that out, some of it is clearly that they are afraid the credit will be used instead to pay taxes they've owed from past years. They didn't say it like this, but they may also be afraid that they'll get in legal trouble for having failed to file in past years. Next slide, please. Other common concerns were that they are afraid that if they claim the credit, they will lose their eligibility for other benefits, or belief that they are not eligible because they get those other benefits. And of course, some people didn't know how to file or didn't know that they could get free help. Next slide, please. We did one group with mixed immigration status families, and they, of course, had a particular set of fears around immigration, and those were very strong. They were afraid to even, some of them, to even show their papers to a free tax preparer or to call an 800 number. We asked them where they would first go to get information on whether they were eligible. And they said they'd go to their immigration attorneys, which is consistent with the answers we got on our census focus groups about who they would ask advice about whether they should respond to the census. And as we did on the census, we're working right now with Latino Justice to create resources for the immigration bar so that immigration lawyers are prepared to answer questions from their clients. And we will share those with everybody doing CTC outreach, because they may also be useful for you working with mixed immigration status families. I also want to lift up that even fully documented families are concerned about whether claiming the child tax credit will affect their immigration status because it might weigh against them as a public charge. We think it's important to include in materials that the CTC won't count against them as a public charge, but be aware that people say, well, it's okay now, but that's because of a change in administration, and another change in administration could make it a risk later. We do think resources need to make it clear that parents with ITINs, that's the tax number you can use to file tax returns if you don't have a Social Security number, can claim the credit so long as the children have Social Security numbers. And they also need to make it clear how to get an ITIN. Next slide, please. We also did a focus group with non-parental caregivers. Think about grandparents, aunts and uncles, people who are raising the children because the parents, for one reason or another, are not available to do that. These focus groups identified many of the barriers that we heard in other non-filer groups. And we do think it's worth including in materials that you don't need to be the legal guardian to claim the child. All you need to do is be able to say they lived with you for more than 6 months. But that is not the unique non-parental caregiver barrier we ran into. The non-parents who would be able to claim the credit were not willing to do it if the parent was claiming the child. And there were a bunch of motivations behind that. One is that they'd like to support the parent so that the parent can get their lives in order and become the children's caregivers. It was worth it to them to not get the credit and let the parent claim the credit for that reason. In some cases, they said, well, yeah, the parent claims the credit, but then they spend it on the children, so it's fine. And then there was, a couple where they said it was more important to keep the children with them when they're safe than to risk the parent taking the children back in order to get the child tax credit and take them into a potentially unsafe situation. And we also had a couple who expressed some reservations about giving a large amount of money to parents who might be struggling with managing money, maybe because of a substance abuse disorder. So I think there's some real concerns on the part of non-parental caregivers where they've just made a judgment call that they're not going to claim this credit because it doesn't make sense for their family. Next slide, please. We also did 2 focus groups with service providers, and we did that because we believe quite strongly that it takes more than just ads and public news about the child tax credit, that for the people who have been hesitant to claim even their stimulus payments, they really need someone they trust explaining to them that this is safe, it's a lot of money, it's easy, and this is how you do it. And a lot of the people that they trust to give them this information are also the service providers who work with their families. So we conducted 2 focus groups to understand how to get those people who are service providers to do outreach to the families they work with and also engage their colleagues in outreach. And the most persuasive message we found for the service providers is that they're trusted by the families and one of the few places families would learn about this opportunity. We also tested messages about how it's easy to help people by referring people to experts, so they don't need to be an expert themselves, and that was also useful. We also found that there was a split between 2 kinds of providers in terms of their comfort about talking to families about the child tax credit. The ones that are primarily working with the children, like teachers and childcare providers, were really uncomfortable talking about taxes because it seemed too personal. And they were even more uncomfortable talking to immigrant families about immigration and eligibility because they were afraid the families would feel identified as undocumented and that the families would stop sending their kids to the programs. In this situation, while we don't think it's the best way to do outreach generally because it's not person to person, it may be the most useful thing we can do is put up posters and flyers and provide other kinds of information that's directed at all families, but includes information about immigrant eligibility so that the teachers and childcare providers don't know that the families don't feel singled out. The group that was much more comfortable about doing outreach are the ones who work all the time about getting resources in the family. Those would be, the people who work with homeless families, domestic violence providers, people who talk already about where can you get income, how can you apply for benefits. They were more comfortable talking about taxes and they were more comfortable talking about immigration status and what that meant for access to benefits. So they probably use materials that are more specific to immigrants. Next slide, please. We tested messages that work. So remember I said there were 2 big messages, 2 big barriers. These are the 2 messages we tested that did seem to reduce anxiety about these messages. The first one was about the repayment fear. There are protections in place, so you won't need to pay this money back, even if there was a mistake or a change in your circumstances, as long as your 2021 income is less than $40,000. And then for the fear about the old debt, you should file for the child tax credit, even if you think they might take the credit to pay off old debt, child support, or other debts. Your advance payment will not be reduced if you have overdue tax claim debt, but when you file your tax return to claim the other half of your child tax credit, your refund may be reduced to pay for any taxes you owe. Even if you do not get the second half of the child tax credit, it can help cover the debts owed and set you up to receive your full refund in future years. Now, I should say that the second message the utility of it and what we need to say may change depending in future years on exactly how the law is written. If all the payments are advanced payments, then you would only need the first 2 sentences because you wouldn't have to file a return to get the second half. But that depends on what Congress does. Next slide, please. Here's some other messaging recommendations that come out of the focus groups we did. We really think it's important to lift up that you can get this credit even if you don't pay taxes, because that was clearly a big barrier. And to say that you may be eligible now, even if you were not eligible in past years, or you may be eligible even if you have no work income and receive Social Security or disability. We also found that people didn't think that $250 or $300 a month was very much, and they didn't really understand how much it added up to. And unfortunately, there was some very confusing messaging out there in 2021. And so people thought, well, if I try and claim the credit in October, I'm only going to get $300 per month or $250 per month. But in fact, you would have gotten the full first half of the credit whenever you filed. And so it's really important to tell them the annual benefit and that they can claim it for all the children in the household that are eligible, because families were also pretty aware that the old child tax credit was only available for 2 children, even if you had 5 or 6 in the household. And of course, if you look at the combined increase in the income and then you add on 2 or 3 more children, the amount of the credit is just enormous compared to the past. It's important to say that it won't affect their eligibility for federally funded benefits, and we would recommend listing them like Medicaid and SNAP and TANF and WIC, and that they can get the credit even if they get these benefits. They need specific information on how to claim the credit, including what information they need to provide. And of course, for filing a full tax return, that's a lot more information than just claiming the advanced one. The one other thing is that parents didn't like them. Parents liked the message that this gives parents more wiggle room or breathing room. That was very appealing to them. Next slide, please. There were messages that didn't work, and I want to lift those up to you. For most people, the message that the child tax credit was reducing poverty was actually a pretty weak message, and we were surprised by that. We also tested a message that is absolutely based in research, that a few $1,000s for low-income families would make children healthier, do better in school, graduate high school and college, and work and earn more as adults. Uniformly, non-filers and the service providers did not buy it. They believed it was overblown and overreaching, and the parents were very clear that they believe that what they teach children in the home is what matters about how kids do down the road, not the amount of money in the home. And, I'm sure that part of that is because they want to believe that their children are going to be fine. But, it was pretty stunning to me that the message that is the most convincing for most of us that do this work, that has a major change on children's outcomes, did not work. The message that it gave parents more wiggle room, that really worked. So next slide, please. I wanted to make sure you know that the place they first think to go for information is the IRS website. They want to hear from the IRS that the information that we're giving them is correct. So if you're developing your own materials, we strongly encourage you to link to the IRS website and to the specific pages that address whatever issue you're talking about. It will really give people more confidence in what you're telling them. They do also trust government agency information. And so we believe that working with your state agencies such as SNAP and WIC and TANF and Medicaid is a really good outreach strategy to reach families. And there's been some concrete evidence that that's paid off in some states, where states tried texting the families they were serving and so forth. Next slide, please. I will answer questions when we all answer them at the end, but I did want to mention that we have a listserv where we put out outreach tools and information as they become available, and you can sign up for it by using this bit.ly. So, write it down, take a snapshot of it, and sign up so that you can get our outreach materials as they become available. Thank you so much. And I'm turning it over to you, Christine.
Yes, thank you, Deb, so much. That was such a wealth of information covering so many different groups that are involved in the CTC, from the families to trusted messengers. And I greatly appreciate all the ideas you suggested throughout your presentation to tackle the issues you presented in order to get families connected to payments. It's so important to get real world perspective on how families feel. And I'm sure the focus groups was no small task. And thank you for sharing all the messaging that resonates with families to encourage them to file. So last but definitely not least, we have Richard Auxier, who will be sharing a super cool map with state-by-state data on where children who miss out on the CTC are located. Richard is a senior policy associate in the Urban Bookings Tax Policy Center. His work focuses on state and policy, budgets, and other finance issues. Before joining Urban, Richard was on the staff of the DC Tax Revision Commission and helped write the commission's final report on recommendations for improving the district's tax system. He also was previously a researcher and editor at the Pew Research Center. Richard attended the University of Maryland for his undergraduate degree and his master's degree in public policy. I'll go ahead and hand it off to Richard.
Awesome. Well, thank you so much, Christine, and thank you, CBPP, for putting together this event. I'm going to take over and share my screen so you can actually see the map that I am talking about. So as Christine said, my name is Richard. I work at the Tax Policy Center, and we put together an interactive map that shows where children are at risk of missing out on the expanded CTC. We've had 3 great presentations so far that have gone over, what the expanded CTC is, like, the benefits that it's providing, who it's helping, and, who is possibly missing out on it. And I want to kind of like, fill in the end and get to the where we might be able to find these people. And what this map, this interactive map, is showing are Treasury data that was put out over the summer. And the Treasury data is their counts. They are zip code level data that are counts of children that meet 2 qualifications. One, they appear on health insurance tax forms, specifically the form 1095. This is a form that is importantly created by the IRS and sent out to families if they have health insurance, even if they don't file. So specifically, think of a lower income family that benefits from Medicaid, that doesn't file a tax return, but they still were on Medicaid. And so a document was created for them. So we know, and their children are on it. So we know these children exist. And then Treasury matched that with the children who do not appear on tax returns. So the children that are at risk of missing the CTC, these are children who, again, one, appeared on a health insurance form, but did in 2019, but did not appear on a tax return in 2019 or 2020. So some important qualifications about these data. One, it's static. This is a snapshot. This is data that the Treasury Department put out in the summer of 2021. It hasn't been updated. It's not moving up and down as we know that people are getting the advanced CTC payments. It's also not comprehensive. It does not include people who do not have health insurance. For example, Deborah was talking about mixed households where possibly there's public charge concerns. And so those types of families might not be getting health insurance. And so therefore they are possibly on the list. It absolutely does not include any children who were born this year because they wouldn't have been in existence to be on any of these forms. But it also definitely is an overcount in some ways because there are definitely children who are in this Treasury data and on this map who, in part because of the great outreach efforts we've been describing, have been connected and are getting these type of benefits. But the reason we think this map is helpful, the reason we created this map is because we still think that the characteristics, the reasons and the places where these children live are consistent. And that if we look at this map, it'll give people who are looking to find these families, a guide to where they should focus their attention. So right now you're seeing a bunch of blue. I'm going to zoom in on the southeast. And you'll see, if you look up in the top left-hand corner, you'll see that we're showing this data in 2 ways. You can see it as a share of children and a number of children. And that is, I'll move around. If you look at the share of children, which are the defaults to, you'll come over and you'll see some dark blue over here. Before I get into this, the shades of blue do not represent good, bad, or other. It is merely a count. Having a high degree does not say anything about this area. In fact, what the blue is really just doing in both ways of looking at this data, it's saying, look over here, look over here. There's probably a lot of children over here. What you really want to do and what this tool really does well is break this data down by the zip code level. So if you're going to share of children, which is, for example, in South Carolina, I'm in zip code 29414. There are 262 children in that zip code that met Treasury's qualifications, had health insurance, were on a tax return. And that is 0.97% of South Carolina's total number of children. If you look above the zip code, you'll see that there are 26,987 children on Treasury's list in South Carolina. The reason the share is helpful is because we didn't just want to present a population map. We wanted to give the opportunity, for example, to someone who is working in South Carolina to look at this metric and identify areas of the state where there are high concentrations of children. And as you move the cursor around, you can go to different zip codes where you have 116 children, up to 390 children. This is one of the dark blue areas, because it represents more than 1% of the total number of children in South Carolina who are at risk of not getting the CTC payments. And again, you can jump from zip code 29485 to 29420, 29418. It's my way of saying, use the blue to think about areas and look, but then what we actually want to do is look at those counts, because that's what's important. Now, the share is helpful if you're looking for a particular state's level of data. Let's say you're a national organization and you're considering where to put resources into finding children. So you would just go over to the totals. You'll notice Atlanta just got a lot bluer. It's because Atlanta has far more people. The little area of Charleston I was showing you has gotten a lot less blue. The area in Atlanta has gotten a lot more blue. Again, this is just a different way of showing the data. The numbers are still the same. The number of children, like for example, in zip code 30038, there are 309 children in that zip code. It represents 0.31% of Georgia's total. A small share in Georgia, but that's actually a large number of children relative to the other areas. And again, you want to use this to move around and take a look at different zip codes as you keep going through. So for example, here we go, zip code 30044. There are nearly 1,500 children who have health insurance, but who do not appear on a tax form and are thus at risk of missing the CTC. And what we hope this tool is doing is it's giving advocates and policymakers an opportunity to take a look, go through these zip codes and see where there are high concentrations of children at risk of missing out on the CTC. If you want more, if you look toward the right-hand side, you'll see there's two buttons, one where you can download the data for Georgia. This will give you a list of every zip code and the Treasury count for children in that zip code, or you can just download all the data for the United States. One last thing about the data, and it's imperfect, there are some areas where there's no data. So for example, in Georgia, zip code 31066, there's no data. We've had conversations with people at the IRS. We think what's going on is these are relatively low population zip codes, and so the data is being suppressed. But if you look at it and you read the text below there, you'll see that in Georgia, there are 2,746 children who are at risk of missing a CCC, again, healthcare, but no tax return, throughout the state. And so all this, so these children are there, they are accounted for, they are just not allocated to a zip code. If you scroll down a little on the tool, you then also get into, we've broken down the top 50 zip codes with the highest number of children. A few notes on these data. As you'll be aware of after having watched Ashley's presentation, Latino households and immigrant households are overrepresented in these top 50 zip codes. There are far more in these zip codes than there are nationally. There's also, if you look at the very top and you see Lakewood, New Jersey, Monroe, New York, Brooklyn, New York, very high counts of ultra-Orthodox Jewish communities appear in these zip codes. But one thing that does not appear in these zip codes is a zip code in Texas. And again, that goes back to the limits of the data. Texas has not expanded Medicaid. Texas has a relatively high number of uninsured children, so they're not appearing in this data. Again, this is just a broad tool to try and give you an idea of where there might be clusters of children. It's not, again, a comprehensive count of it. If you keep going down, we present resources on the child tax credit and then a further explanation of the data and how we're doing that. And with that, I'll stop sharing my screen and turn it back over to Christine.
Awesome. Thank you, Richard. This is such a helpful tool to really help people know where geographically to target outreach efforts, and how impressive that this tool breaks it down only not by state, but also by zip codes. Yeah, thank you for all that you and your team have done to create this informative and also aesthetically pleasing map. So with that, thank you again to all our amazing panelists for sharing all the hard work they have done in providing deep, meaningful analysis on the impacts of the CTC on families and pinpointing where the gaps are so we can continue doing our outreach work and ensure that no family is left out from these life-changing benefits. And with that, we are going to transition to the Q&A portion of this webinar.
Thank you so much to all of our presenters again for sharing this wonderful information. There are some questions. And while I'm asking those, if others of you have additional questions, please do put them in the Q&A box. So the first question we have is for Ashley. Ashley, is information available for Indigenous and Native American families from the surveying that you did?
Sorry, it took me a second to unmute there. Yeah, thanks for the question. So the Ipsos polling firm that we partnered with to do this survey has a knowledge panel of respondents, and they did provide us some characteristic data for those survey respondents, including race. But they only broke down a few different categories of race. So we had Black, white, Hispanic, and then an other category and a multiracial category, which of course isn't as detailed as we would like. But unfortunately, we weren't able to break down specifically by Indigenous populations in those results. And the amount of respondents that were in that other bucket was a lot smaller when compared to the Black and Hispanic and white buckets. So that's why a lot of our results in the report largely focus on those three populations. But I will say that we did find results based on race, on how these payments are impacting families and their financial well-being. So I do think that that's important to continue lifting up as we're thinking about how these payments will impact different families.
Thank you for that. Our next question, I'm going to direct to Jenny. The question is, will there be social media and flyer toolkits available, or do we need to create our own marketing materials?
Great question. And no, you do not need to create your own marketing materials. I'm going to put a link in the chat bar that directs to our outreach toolkit. So we made this toolkit for CTC outreach. So it's really for around like the advance payments. And we are going to do a refresh of this kit to add a little bit more information about getting the rest of the payment. And that will be out by the end of this year, and you can use it next year in your outreach. And this toolkit does include social media graphics, a flyer, a translated flyer, and other outreach materials that you can use. We'll also be making some other outreach materials next year for the EITC and other tax benefits. So stay tuned for all of that. It should be coming out by the end of this calendar year.
Great, thank you. The next question is for Richard. Richard, you shared a little bit about why there may be some zip codes that are not included in the map if there's not enough children represented, and that the map really is showing clusters of children. Are there other reasons why a zip code may not be listed in your state that people should know about?
Right. So the most common, if you looked at the map, you would see the areas of blue, and then you would see gray areas, and it would say there's no data, or there's no data for this, but there are X number of children throughout the state. So unfortunately, that's a data limitation that, you know, and there was not an official reason, but given conversations we've had with the IRS, we're led to believe that suppression is the reason why, because there's just too few people there, so we can't get that. There are other areas in states where, if you go back to the map, it's translucent. And that's just because, you know, it's zip codes are used for mailing, like literally just mail. And so there are areas where the mailing lines don't perfectly match up to population lines. And so there would just simply not be any data for there because there's really no people there. But in general, the greater the population, the more likelihood there is to find information and data on the number of children.
Thank you for that. So the next question I'd like to pose to the entire panel, anyone feel free to respond if you have something to share. Is there any research or findings that highlight the mental strain that non-filers experience because they're afraid of the IRS? Has anyone seen anything or heard of anything in development?
It's a great question, but I haven't heard of anything.
Okay, so we'll have to stay tuned for that one. The next question for Ashley, another question for you is, did any respondents report that they heard about the CTC from SNAP, Medicaid, or other public benefit agencies?
Yeah, so that question where we asked folks how they heard about the CTC, we provided 14 different options they could select from. And one of them was local social service office, which is the closest I think we have to those specific government benefit programs. And very few respondents did select that option. I think it was only around 25 respondents or so. By far, the most common way people were hearing about it was either through the IRS letter or the tax form itself, or from those more informal channels like TV, social media, and through hearing about it from friends or family. But we did try to include a lot of different kinds of community organizations as well in the response, like schools, community centers, childcare providers, grocery stores, and those also weren't as common for how people were hearing about it.
And one follow-up question, in those 14 options, was there an option if people heard about it through their healthcare team?
Yeah, we did have an option that was health clinic. And again, that option didn't get as many responses. It was only a handful. I think it was around 1% of responses in comparison to the other ones.
Thank you. So another question is, what about messaging to foster parents? Are there any materials for foster parents, or are there any findings specifically that speak to foster parents?
So we did not specifically interview foster parents, but foster parents are eligible to claim the CTC for their kids. And thank you for the question, because when we worked on the census, we did foster parent specific materials, and we can try and create those now. I think that'd be a great addition to the outreach tool. So thank you.
Okay.
Oh, sorry. I was just going to say, I don't have any specific foster parents, but I will flag that the group JBAY, John Burton Advocates for Youth, have really great resources on the state EITC for foster youth transitioning out of the system that are very targeted at that population and questions that they may have as they file a tax return. So not quite the same population, but I think they do a really great job of formatting tools specifically for that population of folks who are transitioning out of the foster care system. And that may be something to look at as well.
And if I can add one thing, we've had conversations with the team in Philadelphia who was looking at the Treasury data and our map and noticed clusters of children in places where there are not many residential homes. And they were able to piece together what it was that there are actually administration buildings who work with the foster system. And so these children's home or their location was being listed as this administrative address and not their actual address. And so just to keep a heads up about that, there might be addresses and places where you think you can contact these people, but it'll lead you to kind of like a different answer, just having to think through those issues. And that was one of the ones that popped up for us.
Thank you all for that. And also thank you in the chat. We do have some resources shared to address the question on research related to people experiencing mental stress because of fear of the IRS. It's related. So thank you so much for sharing that. Another question for Richard. Do you know if that is the issue with the 20011 zip code in DC?
I do not, but I'm happy to look at it. It is something though that we've had to, you have to take a look at each locality's specifics, because there are just things that you can't get from the national map until you take a closer look. So I'm happy to take a look at it. But there answers are not always simple. You have to take a minute and go through the actual location.
Thank you. And thank you, Ashley, for the resource you put in the chat. We will capture these resources to share as part of our follow-up. So another question about the map, Richard. One person says they're concerned because the poorest zip codes per AGI, the bottom 5% nationwide, don't show up on the map. Is there anything else you can share about that?
Just that, I mean, I haven't been made aware of that or told that in the past, but again, it is not, if that is true, it is not because they are being excluded because they have relatively low AGI. They're being excluded because they have relatively low population. And so a high income or low income community that has a low population is not going to appear on the map. That said, that's why we provided the top 50 zip codes. And if you look into resources, there's a blog post that discusses the top 50 zip codes. And then again, talks about the characteristics that the communities with high concentrations of children at risk of missing out share, such as high levels of Latino households, overrepresentation of immigrant households. And these are things that you can, again, combine with the great work that kind of like Ashley and Deborah have brought to this conversation, help you understand where you might want to look, even if that zip code is not included in our data.
That's helpful, thank you. There's another question that's come in, and one came in earlier that we typed the answer to, but I'll respond to this one live. I hear you have to pay child tax credits back during the tax season as income. Is this correct? And so the way it works with the advance payments is that when people get advanced child tax credit payments in 2021, those payments are protected if someone owes back taxes, if they have federal or state debts, or if they owe child support. The advance payments can be garnished locally by financial institutions. When it comes to filing a tax return for tax year 2021 in 2022, then the child tax credits can be offset if someone owes back taxes, if they owe child support or have other debts. They do not have to pay back the advance payments that they already received, but if someone owes debt, they may not actually receive the remainder of their child tax credit as a refund sent directly to them. And I'll also put a link in the chat to where we have an answer to that question in written form. Another question, I'll pose this to everyone first. What is the possibility of extension for the advanced child tax credit payments or increased child tax credit after the current year? Okay, it looks like, oh, thank you.
I was just waiting for someone else to jump in. I mean, I definitely don't think I could give you a crystal ball of the amount of chance, but I guess what I will say is what's currently in the Build Back Better Act is an extension of these CTC monthly payments and the bigger amount of the payment for one more year, and the chance to make the full refundability, the part that makes it available to the lowest income families, permanent. So if the bill passes as is currently written and as currently being negotiated in the House, it would be extended at least for one more year, and the full refundability would be permanent. And then after that, I think our strategy will largely be to try to continue to make those extensions go beyond that 1 year. And I think that's partly why it'll be so important for us to really do a lot of outreach over the next few months so that as many people can get the benefits of this program as possible. in the year that we have. But if that bill does not pass, the last monthly payment would go out in December of this year, next month.
If I could, I would add that as the bill is currently written, instead of people claiming it half in advance and half when they file the rest of their tax credit, they would get all of it as an advance credit monthly throughout the year. So if the bill passes, which we all devoutly hope it will, it's worth taking some time to read exactly how it's going to be done, because that will affect the language of your outreach tools. And so you just want to be careful to look at that. And there may be some people, specifically children with ITINs rather than social security numbers, who are eligible for the 2022 credit that weren't eligible for the 2021 credit. So we're really working hard to get it extended. But there may be some changes, some of them for the good, if some of them could be for the bad, depending on negotiations, but really look at when it's final, exactly what they did, because it may have changed.
Thank you. And just a comment to clarify, in case there is some confusion, that child tax credit payments are not counted as income. And so people do not have to worry about if they need to report this on their tax return as income. The advance payments are an advance tax of a tax credit. So they do not need to be reported as income. Deb, there's a question for you. Will you share the messaging research and the findings from the focus groups and other messaging work you've done with Lake Research?
Yes, absolutely. I expect to get their written summary the first week in December, and we'll need to go over it with them before we can send it out. And then we'll, I'm not sure exactly how we're going to disseminate it, but at a minimum, we will send it to Christine and Roxy to send out to the list of people who attended this webinar. We may have the capacity to do a formal presentation. I don't know, but I mean, my presentation here was kind of my take on it. I'm not a trained communicator and I didn't work off the recordings, but it gives you a big sense of how rich those are and our key findings. And we want to get you the most nuanced information we can as soon as it's available.
Thank you for that. And I will address just one final question about our outreach materials that we create. I believe that we will have some sample social media posts in Spanish as well, in addition to the flyer and a couple of other resources. We won't be able to translate everything, but we'll see what we can do in terms of the social media resources. And if there are specific requests that you all have for your outreach, specific languages, or if there's a certain graphic that you really want to have translated, you can always reach out to us and we will do our best to support your request that way. So I'm going to turn it back to Christine to close out.
Awesome. And here is our, Roxy, did you?
No, go ahead.
Yes, so here's the last slide. Here's our contact information. If you want to keep in touch or you have any specific questions, and you could also sign up for our listserv where we keep y'all up to date on outreach toolkits or any news that we get. Roxy, is there anything you want to add?
Thank you again, everyone, for participating. If you have any follow-up questions, you do have the contact information for presenters, so feel free to reach out to them again and reach out to them directly. And thank you again to all of our panelists. We really appreciate your time. Thank you for the work that you are doing. Have a great day.
And thank everybody on this call for the work you're going to do to help get families get this really valuable credit. We appreciate it so much.
And we will send the recording. And I see some people want the chat as well. So I'll go ahead and save and see if we can share that out. But yes, have a wonderful day, everyone.